The Canadian health system is experiencing increased stress from trying to meet a rising demand for health services with limited resources. Since 1998, North Network, a telehealth program in Northern Ontario, has linked distant healthcare providers using video conferencing, electronic medical devices, and other advanced technologies. Today, North Network connects over 185 sites and enables more than 2,000 real-time clinical and educational events every month. The Alaska Federal Healthcare Access Network, or AFCAN, is a statewide telehealth project that was created to address the unique challenges of the largest, most rugged, and least populated terrain in North America. Alaska chose a different technological solution to collapsing geography. AFCAN connects 248 communities with a range of specialist care services via electronic messaging and rich content attachment such as images, reports, and histories. This method, known as Store and Forward Telehealth, allows specialists to respond to electronic referrals at their convenience, reinforcing primary care in the community and keeping healthcare close to home. Store and Forward has several theoretical advantages compared with traditional telemedicine, including lower cost, reduced wait times, and greater access to health services.
Store Forward is when a physician or a nurse collects up a bunch of information about a patient and sends it down to the specialist, very much like a big email, so that it can be reviewed at a later time, that night, the next morning, whenever, and then the specialist will send their opinion and their advice back to the referring practitioner.
AFCAN project was designed by statewide committees. A clinical committee, for instance, that met every month for 4 years. They provided input and leadership to the design of this, and because of concerns about efficiencies and time management, the clinical committee really wanted us to move towards a store and forward solution because they thought that would be the most effective solution as clinicians. And so the project was directed by the committees and kind of limited by available technology, and that's why we have a store and forward system. Video conferencing is clearly best suited for healthcare applications where either you need real-time audio and video, such as in mental health and other specialties, or where the remote consultant needs to basically control the data that they are seeing. Store and Forward lends itself extremely well to the situations where the data can be packaged ahead of time. In any situation with still imaging, video clips, temporal data, ECG data, etc., can be packaged. Store and Forward also has the additional capability of being able to very easily pull data from existing electronic health records and put data into electronic health records.
I recall when we only had the telephone and or the spoken word from a physician at the other end or a community health aide, and we had to depend on a lot of basically a putting together of a mental picture based on an oral description. Now with, and patients sometimes will be flown in at great cost here in Alaska, only to find that perhaps they didn't really need to be flown in, or conversely, you have the patient who wasn't flown in who you find later really should have been. With telemedicine and the actual ability to visualize an actual problem, it can be used not only to discern a diagnosis, but as an excellent triage tool, where, say, the originating provider might be concerned, gee, does this patient need to be seen by the dermatologist or not? I can readily look at the problem and decide whether or not they need to be flown into Anchorage.
For people who are coming in to see us, we know so much more about them by the time they get here. It just makes our job much easier when they're here. And the patients don't go through that really frustrating problem that we've all been through when you go to see a provider and they seemingly know nothing about you, even though you were, there was a promise that you would be, referred and all your information would be referred to somebody who would then pick up the ball and go from there. And that, I think our patients really like the fact that even though we've never seen them face to face, by the time they get here, I know about their problem, I know what was done, and I know what we told them we were planning on doing.
Store Forward technology benefits rural patients in the same way, but also provides benefits for all patients, including those who live in the city. It's also a tremendous innovation that can be used to really improve the efficiency of our healthcare system. It does that really by enabling specialists to be more efficient with their time. They're able to review cases quickly. They can do it when they want to in their off hours and mid hours. and it prevents a lot of unnecessary traffic to their office because they can provide advice back to the referring physician or nurse, who can then talk to the patient and deal with the patient at that end. And it saves the office time for the specialist to those who really need their advice directly.
And we've managed to reduce wait times from 6 to 9 months, which were fairly typical, down to next available appointment. We now use telehealth to refer in for surgery, and so we can do pre-planning for surgery, and we actually have demonstrated that telehealth can be as accurate or more accurate in predicting the surgical process and also the time spent in the operating room.
What we settled on is that we use the same coding rules and the same codes as you would for an in-person, and we just for their administrative purposes, we just put a different modifier on it to show that it was actually a telemedicine case and not an in-person encounter.
Well, at both ends you need some kind of a computer, and that can be a simple computer as a desktop or a laptop, and at the sending end, oftentimes that's nothing more than a digital camera and a laptop or desktop computer, because you're taking pictures of skin conditions or dislocated fingers or wounds. You're sending those images and you're getting advice on how to treat that condition.
The equipment at the referring hand is really pretty simple. There's a video otoscope which is used to take the images of the tympanic membrane. There are digital cameras, basically off-the-shelf digital cameras to take images of the face, oral cavity, things like that. A scanner to scan in documents, a computer to send the images, and that's really what we do most of our work with. On the referring end, it doesn't take that much training to get people pretty facile with using those devices.
The software that we're using is just simple to use. It has to be simple to use. Whatever you're using needs to be easily accessible, easy to send the data from the biomedical peripheral devices into the system, and then, just as important, easy to type or enter a history or answer questions or fields that the consultant may have.
There are several levels to security in store and forward telehealth. The most obvious is that you require the physician to log in with a username and a password. But beyond that, all the data that moves between the systems needs to be encrypted. And that's a requirement in the United States when it moves over the internet. We add several layers beyond that. One example is that we require the data to be signed by the sending organization, so the receiving organization will reject that data if it has changed, if it's been corrupted, or if it frankly is coming from an organization that they don't have a relationship with. The other thing about the other aspect of security is tracking audit logs, tracking who has seen what data. And we've built into our system a very comprehensive audit log, so you know who has viewed a case, where the case went, did they look at it, did they respond, and that's very important because the users then need to know where that data is and what's being done with it. When specialists approach us and want to be involved, we have a fairly rigorous process to make sure their needs are satisfied. Besides the equipment and the software, which are obvious, we start to work with each of those clinicians to design the telehealth system to meet their needs. It's not a one-size-fits-all. It's a tool. It's a communication tool. So we work with them to develop clinical protocols appropriate to their specialty or to their needs.
I think getting started, is the very hardest thing to do. And the problem is that it's very hard to match the capacity to receive cases to the number of cases that are flowing in. And our experience was not that when we opened the floodgates, the cases came flooding in. That's not what happened. I think our experience was more that the cases didn't come flowing in right away. It took a lot of work encouraging our referring providers to try it as a way of sending us cases. And to make it worth their while to do that, we had to get those cases back to them right away and with rich content, with good comments, with a lot of helpful advice.
I think there's a tremendous opportunity for Store Forward in Ontario. Like every jurisdiction in Canada, there are significant health human resource shortages in Ontario, i.e. there's really a shortage of specialists who to see the number of patients that they need to see. And we've found in different jurisdictions that you can actually improve specialist efficiency by in the neighborhood of 30% in some specialties by using store-forward type technologies while providing a better quality and better access to care for the patient at the same time.